Hello, everybody. Thank you so much for coming to our CSU Pueblo, Colorado State University Pueblo webinar here, introducing the Bachelor's of Applied Science in Health Science and Administration. My name is Nick Lagrasso. I am the enrollment counselor here for our Extended Studies online programs. We also have Dr. Carol Faust and Shauna Reich, who is our academic advisor. Dr. Carol Faust is the Associate Dean and Director of the School of Health Science and Movement. So today we're going to be going through agenda first and diving deeper into this program so you can learn a little bit more about it. So for the agenda, I'm going to let the other two introduce themselves a little bit more. We'll go into program details as well as costs and scholarships and admissions requirements. All right. So Shauna, if you want to introduce yourself first, and then we'll go into this slide.
I'm Shauna Reich, as Nick said. I am the academic advisor for the Health Science and Administration program. So I work directly with students as they're kind of building their academic plan and helping with registration, answering questions, getting connected with faculty and Dr. Faust if there are additional questions after that. As we look at what we accept into the program, this is really a fast track way for students who are working in healthcare or an allied health field to finish their degree and earn their bachelor's degree. So when we're looking at transfer credits, we accept students who have an associate's degree, whether it's an AAS, AGS, or just an associate's of science or an associate's of arts. Then we also take into consideration the allied health certification. So whether that's medical assisting, dental hygiene, EMTs, we've really seen a wide variety of students in various health fields in this program so far. So we look at direct transfer credits. So those are going to be things that are have a direct equivalent for our program. So English, math, psychology, those types of courses that we can bring directly into the program and count as transfer. Then specifically for this program, students can receive up to 30 credit hours of escrow towards the degree as well. And we'll go into that in a little more detail here in a little bit. But the huge benefit of this is that you're getting credit hours for the work that you've done. So again, fast tracking you to that bachelor's degree.
Fantastic. Yeah, and some other benefits that are part of this program, it is 100% online. So what the word asynchronous means is that it is on your time. You're not dedicated to a certain class time to complete your work. It is very transfer friendly, as Shauna just mentioned, for your community colleges or other credits out there that from colleges you've taken. And then these classes run 8 weeks. And since they're running 8 weeks, we still work in the 16-week semester as a fall, spring, and summer. So they are accelerated, still learning the 16-week curriculum. But that gives you a lot of time to just focus on that class specifically and then move on to the next one. And as Shauna alluded to, these are dedicated to allied health professionals. We're going to go into more details of the outcomes with that. But you can take these classes part-time or full-time. So Shauna will work with you on whether you're a part-time student or a full-time student, building your graduation pathway. Another thing to look at is we are a school that is accredited by the Higher Learning Commissions. And you always want to look at accreditations when you're looking at different programs out there because they are looking at curriculum to make sure you're learning the correct material in the current time period. So that's just kind of a really brief introduction to this program, but I'm going to hand it off to Dr. Carol Faust now to introduce her and to go into more details here. Oops, sorry. Go ahead.
Yeah. Hi, I'm Carol Faust, and like Nick told you, I'm the director of the School of Health Sciences and Human Movement, which basically just means that I do the administrative piece to make sure all of the academic programs are administered correctly, and I work with all of the faculty and staff. And so this program, the curriculum does the program does land in the School of Health Sciences and Human Movement. So Nick, if you'll go to the next slide.
Yes, of course.
So if you look at the course offerings for this program, we have a core that everybody has to do. And that core involves the health science curriculum, primarily around issues such as health communication, epidemiology, disease prevention, community or global health. We also delve into information about the healthcare systems and the diversity and equity that's involved in healthcare systems, and anything that has to do with health issues with humans and animals. So this is the core curriculum. And in the core curriculum, you also do a research course. So you get a little taste of what it's like to do a research design, a research study, collect some data, and write up a report, just so you get a little experience in how to understand how to read research. And then the last course in the core is the field experience. And that's where you'll, most of you are probably already working in health science setting, but you will be doing some hours in a health science setting with your position, whether it's volunteer or paid. And then you will be doing a project and being supervised through the a university instructor with that field experience. And so just to reiterate, you can use your current job or any kind of current volunteer experience that you have. If you're not in a job right now, or you're not volunteering, then we can help you to figure out where you might do those hours to get the credit for field experience. So that's our core. And then along with the core, you have to do some basic general education credits. And for most allied health professionals, you have those completed with your transfer credits. But if you don't, then we'll work with you on getting that coursework. And then depending on how many hours are transferred and how many escrow hours you get for your license or certificate, then you may have to do also some elective credits. And the list of elective credits are very long. There's a lot of business, administrative, sociology, psychology, and even social work classes in those electives. And the other really cool thing about this program is that it can really prepare you for graduate school. So we have people that come into this program and they prepare, for instance, for the Masters of Social Work. So we have the prerequisites that you need for that program embedded into the core and the electives of this program. Or some people might want to prepare for the Masters of Business Administration, and we have courses embedded in the electives for you to take to be able to be ready to be admitted to the MBA. But a lot of people, they just choose their electives based on maybe even a job they're wanting to apply for, or an advanced position in their current organization. So that's the real beauty about this curriculum, is you get to really build the electives to meet your needs and to learn the information that you want to learn.
Great.
We touched on escrow credits a little bit at the beginning, but this, I work with students individually as they're admitted into the program to determine how many credits of transfer you have, and then how many credit hours of escrow we can award you for your certification or your licensure. So the maximum we can award you is 30 credit hours, and those are awarded in your very last semester in the program before you graduate. You can receive up to 10 credit hours of upper division. So when we're looking at graduation pieces, you have to have a total of 120 credit hours. And so that's where we kind of piece together and add up the transfer credits, the core credits and elective credits that you need, and then how many escrow credits you're going to get. But within those 120 credits, we need 40 credit hours of upper division. The really great thing about this program is most of those are going to come from those core classes. So really most of that is going to get covered between your core and then potentially your escrow credits. But we can do up to 10 credit hours of upper division escrow credits, and then 20 lower division credits. And that's really based on what allied health certification you have, and then also how many credit hours you had as part of your allied health certification program. But again, I work with students individually. We walk through where those credits are coming from, how they're getting awarded and when, and then what's left to take. And so I put together an advising checklist for each student so you can see really point blank what you need, what it's going to take to graduate.
Fantastic.
So I want to just touch a little bit on the learning outcomes of this program. So we do have specific student learning outcomes for the program as a whole. So by the time you finish this program, you should be able to summarize and synthesize information that's relevant to improving population health and healthcare issues. So you should be able to have general basic information around health sciences and administration. You should be able to read and interpret scientific research and apply that research, apply methods of research, statistics or study design, or any kind of reporting. So we want you to have that basic background and information so you can be able to go out and do research and be able to make best practice kinds of decisions for your job and in your field. You should be able to evaluate and integrate critical concepts. So we want you to have skills to be able to critically think about problems in your field and be able to address those professional problems in an experiential type of way where you try solutions that are best practice and that you use your time really effectively. We want you, and we hope that by the time you finish your program, you'll be able to orally and written and communicate in a written way, as well as be able to communicate through mass communication regarding subjects related to your health science field. And then lastly, we want you to be able to apply and demonstrate the knowledge, the skills, and the critical problems in that setting, in the setting that you're working in, whether that's, you know, Shauna mentioned, it could be anything as broad as working as an EMT, working as a LPN, working as a occupational therapy assistant, or a surge tech, or even a vet tech, or in a pharmacy setting. So it's a very, you know, this program is really, really broad. So we really want to work with any students that are wanting to bridge to a bachelor's degree that have any kind of a health science or allied health background.
Great. And just to kind of go off that, what would this lead to in certain positions going forward for them once they receive their bachelor's?
Right. And so for most of our students so far, they've been able to attain better jobs, better paying jobs. They've been able to advance in for many of them, the organization they're already in, they were able to advance to higher positions that required a bachelor's degree. I also know that there are students that have completed this program and then entered into a master's program. And then I know that there are also students that complete this degree more for personal reasons. You know, they're just really wanting to finish their bachelor's degree. They're wanting to be a good role model, say for their kids or for people in their family. And they're just wanting to advance their education. And, you know, I try to remind them too, that that's going to make them well poised for a new job, or, you know, for them to go out and look and see if there are any jobs they now qualify for with a bachelor's degree. But I think the primary motivation for most students that enter into this program is that they want to advance in their profession. They might want to become a lead, or they want to get into an administrative position or a higher level position.
That's wonderful. Thank you for that. And this is important for all students, right? We talk about costs and benefits to finish your bachelor's. Just so you are aware, our cost per credit is $360. And that is going off of what Shauna talked about with the 120 credits, depending on what you transfer in and everything like that. We do have transfer scholarships here at CSU Pueblo, and you just have to ask during the time frame you're applying, and we'll be able to explain those scholarships to you. And as you are a student here at CSU Pueblo, we have current foundation scholarships that you can apply for as a current student. So there's opportunities and funding available if you ask the questions and search for those opportunities. But going forward, if this is the right fit for you, and this is something you're very interested in learning more about, you can always apply to our school and connect with Shauna or Dr. Faust to ask more questions to make sure we are a good fit. But the process with that is to fill out an application. So your first process fill out that application. You can find that on our website, csupueblo.edu. Once you submit that application, then we will need a full academic history, and you can send that electronically to info@csupueblo.edu. And if you have any issues, you can always reach out to me, and my contact information will be at the end of this webinar. Then from there, you would be confirmed your attendance. Once you got admitted, then you would meet with Shauna, your advisor, and you would walk through what classes you would be taking for your first semester. Again, we're looking for that specific ASC, AAS, AS, or AA. But again, please reach out if you have any questions about that. But going forward, this is our contact information. If you do have any questions, we really appreciate your time and taking the time to listen to our webinar and learning more about our Bachelor's of Applied Science in Health Science and Administration. So thank you so much, and I hope you're having a wonderful day.
Thank you.